They are pivotal in the public health response. So let's get started. I am pleased to turn the event over to Anna Cody, FYSB's Human Trafficking Advisor and Federal Project Officer for the National Runaway Safeline. Thanks to all of you again for joining us today. And also a huge thank you to our hotline representatives, Susan, Megan, and Katie, for your dedication and commitment to this work and for coordinating this conversation today. Thank you so much.
Thank you so much, Debbie, and welcome everyone. I'm Anna Cody, and I serve as the Human Trafficking Advisor for the Family and Youth Services Bureau. And before we get started, I wanted to share with you a couple housekeeping items. Number one, this session will be recorded. We think it's important to keep information, valuable information posted on our website. So after a few days, you will receive a link letting you know that recording has been posted in our website. So keep an eye on that email. Number two, this National Runaway Safeline will send an email right after this conversation.
Yeah, I have these Bluetooth.
Please mute your phones as well. It's a housekeeping item. So also you will receive an email with a lot of the resources they're going to be sharing today, the hotlines. We were unable to put all the information into the chat room. So we're going to be sending an email with the data, fact sheet, all the information that you will need from this webinar. The third one is, let me see, the Q&A session. We do have a space for Q&A sessions. We do have a lot of information, and we want to make sure the presenters have an opportunity to go through all what they have prepared for us today. The Q&A session will be at the end of the conversation. However, you can use your chat box at the bottom to write your questions throughout the presentation. Jeff and I were going to be keeping an eye on the question and compiling. So at the end, everyone will have an opportunity to respond to the question of the presenters. If you have a specific question for one of the hotline representatives, please let us know. This is for Susan, or this is for Katie, or this is for everyone. So just make sure we are answering correctly all your questions and answer. And with that, I do want to introduce Susan Frankl from the National Runaway Safeline, Katie Ray Jones from the National Domestic Hotline, and Megan Carter from the National Human Trafficking Hotline. To this presentation, thank you so much for joining us today. We are excited to hear about the impact of COVID, the lessons learned, and what the plans of the future have for you, and how your operation will go from now on, knowing that a pandemic has passed over a year. So thank you everyone again, and let's get started.
Well, thank you so much to both Debbie and Anna. It's certainly a pleasure to be with all of you and have the opportunity to speak with all of you today. And I just want to, it is both an honor and fun to be with Katie and Megan, as well as we get to kind of share out with all of you many of our shared experiences over the past year and many of the things we've learned, but also the unique things and challenges that each of us have also experienced. But to get started, I want to, as Anna had mentioned, my name is Susan Frankl, and I'm the CEO of the National Runaway Safeline. And we are a 501c3. We're a nonprofit organization that's been in operation. Actually, we are celebrating our 50th anniversary this year in 2021. We are based in the city of Chicago, but we serve the entire US and US territories. We also are honored and very fortunate to serve as the federally designated national communication system for runaway and homeless youth experiencing homelessness in the US and youth in crisis. So we have been doing that work for quite some time, and in that capacity are able to provide 24-hour, 7 days a week crisis services for young people, primarily ages 12 through 21, who again may be experiencing some type of crisis, who may be thinking or contemplating leaving home, who may have left home or facing homelessness in some other capacity. You can see here as the slide notes that our mission as an organization is really to focus on keeping America's runaway homeless and at-risk youth safe and off the streets. And each year, we're making around approximately 125,000 connections to young people and family members through our hotline, online, and other resources that I'm going to tell you a little bit about here in just a moment. So we're going to talk a little bit more just about exactly what the National Runaway Safeline does in terms of the types of services that we provide. And what's noted up here, and you can see the 1-800-RUNAWAY is really referencing our hotline number, and then all kinds of resources, services, and information are also available on our 1-800-RUNAWAY.org, which is our obviously is our website, but also please know that that is also the location to access all of our crisis services as well. As an organization, we are focused on providing trauma-informed, solution-focused crisis intervention services, supports, and access to referrals and information, again, for young people and families, but predominantly young people ages 12 through 21. And through the work that we do through the crisis, our crisis services and our hotline services operate, again, via a traditional hotline, so our phone system, as well as a myriad or menu of digital services, including live chat, the text, which is referenced here, which helps just link young people to additional services and resources, as well as an online crisis youth forum, and an email, live email, etc., to provide a myriad of choices depending on how a young person or how a family member may be most comfortable in reaching out to us. Aside from the crisis services, within that we offer a number of other services, a message service, which is really designed to open up and start communication between young people and their families. Conference call services, which helps us often mediate difficult conversations between a young person and a family member, and to also help make sure that we're helping that young person really determine what the next steps are best for them, what resources are available, and how they best link to those services. And then just also like to note and highlight that we operate our Home Free program, which is a national partnership with Greyhound. And we are able to, through this Home Free program, offer access to free transportation home for young people who would like to return to a parent or guardian or to another alternative safe living arrangement. There's lots that go into all of these services, but I just want to give you kind of a snapshot of essentially what we're able to do. Through our prevention arm of what we also are focusing. So not only do we provide crisis services and support 24/7 round the clock, but we do like to always talk about our focus on prevention and the prevention work and things that we offer through that medium as well, which is a focus on things like community education and outreach tools. You can find all of this on our website, but educational tip sheets, blogs, access to other available resources, ways to get involved at a national or local level through our National Runaway Prevention Month, access to our Let's Talk Runaway Prevention curriculum, which is a free 14-module curriculum that is downloadable and easily accessible to be used in your own programs or in your own communities. And then finally, which we've already kind of touched on and talked about, is our Home Free program, again, which is also focused in really a great tool in helping to young people find and reach access to a sustainable and long-term housing options, whether it again is home or to an alternative living arrangement. So I want to talk a little bit as we kind of get into the heart of what this presentation and what I think you're hoping to learn more about, is talk a little bit about what we saw throughout 2020 and how we what we learned as a result of the pandemic that we've all been living through over the past year or so. This is just a quick snapshot of some of the data to be able to share with you from 2020. Please keep in mind a couple of things. When we collect data currently through the National Runaway Safeline, It's self-reported information, meaning we're really depending upon the young person who's reaching out to us to provide the information if they're comfortable and if they want to share some of the data. So this is just sort of a small note so that you're able to see where this information is coming from and how many contacts that this might be in reference to. But we think it's pretty representative generally of the population we serve. This just is intended to provide a snapshot of kind of the main reason or issue, the status of the young person when they reached out to us. You can see the largest chunk certainly being a young person identifying in some type of crisis, and then 36%, a pretty significant chunk, over a third, thinking or contemplating leaving home or running away. So as we kind of take a deeper dive and look at, in 2020, the top issues that were raised by young people when they reached out to the Safeline for services and support, some of these are the family dynamics at 61% is pretty consistent for us, although this is a rise in that number, but still typically falls in that top 3 to top 4 for us. You can see abuse and neglect coming in second, and then peer and social connections and challenges, along with mental health being the other top third and fourth issue that were raised as young people were reaching out to us. This does not mean that these were necessarily the only issues raised, and many young people may raise all 4 of these or some combination and then add other components. This was simply just to give you kind of a general sense of what we were seeing in 2020. So if we kind of move to take a little bit of another look, this is just to influence and to kind of demonstrate to all of you, where were young people when they were reaching out to us at the National Runaway Safeline. What's really important to note here is that 70% of youth who were connecting with NRS were still at home when they reached out. This does traditionally tends to be a larger percentage of our contacts in general. This number, however, did rise significantly over throughout 2020. And I'm gonna share in just a minute some of our thinking as to why we believe that is the case. But just kind of to note, that also just demonstrates again the critical role that not only the National Runaway Safeline, but other hotlines play in helping to potentially prevent even more difficult, potentially dangerous, life-threatening or life-harming situations, whether it's youth or adults might face, if we're able to help them and link them to available resources through a hotline like the National Runaway Safeline. Other thing just important again to recognize and to note that if we combine and look, about 16% of youth reaching out to us overall, while they may not have been at home or directly on the streets, they were with a friend or family member when they did reach out to us. So let's talk just a little bit more then about what does this tell us? What does this mean, right? If you just look at the data, it doesn't give you kind of a good sense. Well, does this matter? Was it any different than any other years? What we just want to kind of share and just emphasize, which is highlighted here on the slide, is that certainly we did see an increase that I had referenced in youth connecting more to us from home. And we think that this is due to a number of reasons. We have seen a rise in a younger age group reaching out to the National Runaway Safeline, so under the age of 12. We believe that some of this really has occurred due to limitations or access to other kind of available connections or resources or adults in young people's lives that may have been in place prior to the pandemic. And now young people really are looking for someone to reach out to, a place, someone to talk to, a listening ear, I believe, as Debbie had sort of referenced earlier in her introduction. And we're seeing some of those more formal and informal connections, again, through school, peer groups, sports, other kinds of after-school activities being much more limited. We have also experienced and seen an increase in mental health related issues and suicide related contacts over the course of 2020. We again saw this in the rise of mental health in terms of where that fell and an issue being raised. 2020, quite frankly, was one of the first years in quite some time that mental health issues were actually in not only in the top 3, but in the top 10 for us, if that gives you a sense of the change of what we were seeing. And then again, we think some of these numbers reflect the limited access at times to available resources, whether it was due to school closures, space restrictions, other kinds of restrictions, changes and adaptations that social service agencies and the web and network of amazing providers were also experiencing and had to adjust, adapt, or change as a result of the pandemic. And then just generally, we saw an increase in an overall need, not only in our services, but in additional kind of support and further advocacy. So we really experienced an increase in the number of outbound Safeline, which meaning we were reaching out much more extensively to local resources, making sure those services were available, making sure that young people understood what the expectations might be due to COVID, what other restrictions, et cetera, and to really help be an advocate and make sure they were well prepared as they reached out to those services and supports. Just quick peek at the numbers, which we think this is really, again, really important to sort of understand. Don't want to necessarily go through each one of these for you, and we will be sharing this in a handout, so you will have access to this. But just noting some of, again, the places where we saw some increases, 16% increase in contacts citing financial challenges as a reason, 8% increase in contacts citing emotional or verbal abuse, and then a 4% increase in contacts citing physical abuse as a reason for contact. You can see some of the other numbers. I'm just sort of noting those and pointing those out. And then just when we think about these again, we know that these numbers again are linked to, and what we found were reflective of, there were periods of time throughout the pandemic where in certain communities and in different places, we were finding that there may have been limited to no availability of shelter resources for young people, that transportation was an incredible challenge and barrier for young people to find safe housing and shelter. Just recall, particularly at the very beginning of the pandemic, as we were seeing public transportation, even bus lines, other kinds of transportation really reduce available services, reduce routes that they were traveling, and just so much uncertainty as to whether or not you could access the public transportation or what would happen in using it. We also have seen a heightened anxiety and just, again, this limited access to a lot of these other traditional supports and services and systems that were struggling, and we were all working together just to figure out how to adapt and change. So we believe that this helped contribute to these rises, and then this rise in numbers. And then finally, as we all know, and all of us experiencing the lockdowns, the stay-at-home mandates, the various things that were happening across the country, that young people were finding themselves often in living situations that maybe they would have had other options pre-pandemic, or they found that they were just finding themselves in potentially unsafe living situations without feeling like there were a lot of other options for them. And that was really driving, again, the outreach to us at the Safeline. So as we kind of think about, so that's sort of a sense of the numbers and the overall impact, but I want to also just really talk about what we saw as the impact on us as a hotline in general. And so we've narrowed this down and are working to focus this in a couple of key areas. The first was, what were some of the challenges for the National Runaway Safeline as we moved into figuring out how to address the challenges of the pandemic? So the ones that were service related, which are highlighted here on this slide. So again, what we were finding was an increase in suicide related crisis contacts. Why this was critical for us to recognize, and why it's sort of listed here and called out specifically, is while suicide-related crisis contacts are certainly something that the Safeline has always dealt with, we were finding that this increase in the intensity of the types of calls that we were receiving and the level of imminent risk that our team was experiencing on our crisis lines required us to really think about the impact of these calls on our crisis team, the impact and the necessity for us to provide more training, the necessity for us to really reach out to our other hotline partners to make sure that we were well prepared, and just the overall general impact of this and awareness that we needed to be aware of. I've referenced before, we have seen and continue to see, but saw an increase in crisis contacts from youth under the age of 12, as well as over the age of 21. We typically, as a Safeline, as the Safeline do often receive connections over the age of 21, we see a good chunk of young people who reach out to us between 21 and 25, but we did see a significant increase throughout 2020. Kind of tied to this was the increase in the intensity and the length of time that was needed for crisis connections. So we were seeing where maybe we might spend 30 minutes on a chat, and sometimes our live chat was then requiring an hour and a half or longer, just because the issues and the challenges that youth were facing were so much more significant. And also because of the reality of helping to find resources and available connections at local level was much more, wasn't as straightforward, as communities were struggling themselves, and we were trying to make sure we were helping young people navigate that system. We have experienced an increase in the need for filing abuse and neglect reports across the country. There's not one specific area that we saw this arise in. This is reflective again of abuse and neglect being one of the top reasons that young people were reaching out to us. Anecdotally, I will say, just seeing the outcome of more of those abuse neglect reports, we have seen more that were founded or required to open cases than we have previously. And then one of the other key challenge for us was really access to transportation. Transportation being a key to a young person finding and reaching safe shelter, safe housing, alternative living arrangements, and just the reality of just not having a lot of other safe spaces that were open and available on a more regular basis. Certainly as things are changing and things are opening up, that's different now, but at the height and in the middle of 2020 with libraries, coffee shops, those kinds of places shut down, it was particularly challenging, as we all know, for homeless youth and youth experiencing crisis. As we move on, we had significant challenges related to technology. Even as being the national communication system, we were set up as a call center where all of our team was working out of our Chicago-based office. So we quickly, within a very short time, had the challenge of transitioning our entire team to a remote setup, but also ensuring that our services were maintained throughout that time period. And we never, I'm very proud to say, we never had a moment where we were not available, but just again, the process and what it took to do that, the infrastructure that was needed in order to support a system that was operating fully remote actually required us to integrate an entirely new communications platform and phone system to ensure. So that's a difficult undertaking, not in a pandemic. And we were able to both keep things operating and install a new system that then made it more readily, easily for us to make sure that we had enough people available at any given time, and to make sure that we were operating without any sort of interruption. We really did struggle in the beginning to make sure that all of our staff had access to high quality and high speed, so enough bandwidth in the internet support and services to support their work remotely. We did experience a temporary loss of our volunteer support team, so we do have typically anywhere from 100 to 120 or so volunteers who help in our crisis services center. I'm actually looking at one of our volunteers now, I know who's on the call, but we, for a window of time for several months, we actually had to work without that volunteer support. It was roughly 100 volunteers, which really was a challenge and meant that it added quite a bit onto the crisis services team. And then finally, just generally, we needed to very quickly pivot and ensure that all of our training was moved to online and digitally based systems, so that we could actually make sure we were able to still hire new staff, bring on the volunteers when we had the right technology in place, and all of those kinds of things. So then the final piece that I just wanted to address before we get to some of the opportunities and lessons learned are that certainly staff related, and I think that this may be consistent in many ways across hotlines and probably across just social services in general. But some of the challenges that we really have focused extensively on were related to the mental and physical health and well-being of our staff and our team. and just the resulting, because of the pandemic, because of the stay at home and other restrictions and the remote work, just the isolation. Many of our staff were living in arrangements that worked great when you went to an office to work when your shift occurred, but really weren't as conducive to working from a hotline. So sort of addressing all of those different kinds of things. Certainly a global pandemic coupled with the racial unrest and the tumultuous election cycle had a significant impact. We spent a lot of time as a staff making sure that we were providing safe spaces for conversation and for support, and to really make sure that we were addressing our team's needs and having open, honest dialogue and conversation. I've referenced earlier, but we really had to focus and make sure that our team had the right level and access to internet speed, but also basic office kinds of things. Our team wasn't really planning to be working from home. So we had staff that, had one person who for a long time we realized had been really working off the edge of his bed, trying to make things work. Well, that wasn't going to be a permanent long-term solution. So we had to make some decisions as a team on what we could and couldn't help provide, but just to make sure it was more feasible for the long haul. And then we really had to focus and adjust to the challenges of how do you communicate and operate and function as an entirely different organization during a pandemic. Again, I'm sure much like all of you, but we are still learning that. And I think that will be part of the lessons learned that I will highlight as well. So I just want to jump to some of the opportunities that really came out of the pandemic for the National Runaway Safeline. We really took this, we knew and really understood what we were seeing and hearing from our crisis services team, and really looking at the complexity of the issues. So we were able actually to partner with some of our other hotline partners and other organizations to provide more training to ensure that our team was getting the resources and the support that they needed. I just picked a couple of topics: the suicide prevention, human trafficking, and child abuse. We were able, via the systems we had been able to set up via remote learning, to make sure that we were able to provide that training. We really, with being able to put in and choose to put in a new system, we've been able to enhance our reporting and data analysis functions and systems. So we know a lot more about who's calling us, when they're calling us, what they need, how we staff our hotline better as a result. We're really focusing and taking to heart this opportunity to focus on quality assurance and quality improvement. There's nothing like a pandemic to highlight what you really do well and what maybe are some areas that we weren't doing so well or could use an overhaul. Maybe they weren't working as well. So this was a great opportunity to make changes. I mentioned that we had lost our volunteer base temporarily through a chunk of time through the pandemic. We actually, by the end of May, will have more volunteers on board than we had before the beginning of the pandemic, because we now can have volunteers work and support us remotely. It's opening up many opportunities and providing ways that people can get involved and get on help on our crisis services lines without having to be in our building in Chicago. And then finally, as a result of all of this and learning so much more about who we are and how we were functioning, we've been able to improve our capacity to reduce wait times, to enhance the access to our services and resources, and to really increase the visibility and awareness of the organization through many of the things that we were able to do as a result. So I just want to get to, before I run out of time, to some of the other lessons learned, because I think that this is also a key takeaway and something that we're really taking to heart at the National Runaway Safeline. Something that I say all of the time to our team is, we are absolutely not the same organization today that we were on March 11th of 2020. But that's not a bad thing. That's really, we should take that as a good thing. And then we have to embrace who we are today, but use the lessons and use the experiences that we've had over the last year to just make us better and stronger at what we are doing, and really helping. The end goal is really to serve as many young people as we can, and as many young people who need us. And I really believe that in some ways, this pandemic and this experience of having to pivot and change and be so flexible has helped us to really be prepared for that over the long haul. Some key lessons though, and I will say this about all of our hotline partners, unequivocally, I believe that this has proven, the pandemic in the past year and the role that the Safeline and again our partner agencies have found, is that we are an essential resource for sustaining uninterrupted access to services and resources during a national crisis. We were able to function the entire time and without missing a beat. And that is something just, I think, that's really important to highlight and to note. Key lesson is just never underestimate the resilience of your team. I've continued to be just surprised and in awe every single time when we had to pivot or change and put in a new system or a new way or learn a new technology system, that everyone has risen to the occasion. And we in many ways have again, just really learned to function differently and to work differently together. A key thing, and I will stand by this, is that investment in mental health and wellness for your staff is critical. So we made we already had a clinical supervisor on our team who would provide clinical support for our crisis services team. We invested more heavily in that role. We will continue to do so and are looking at expanding that. We feel that that is a critical component of operating a crisis services hotline and services and resources. It's certainly critical to not think that this might be the only time in our history that we'll experience the need to be prepared for a national emergency or other critical event. It could be weather related, as I know some of our other hotline partners have experienced. It could be a myriad of other kinds of things. We have to be prepared. We also always have to be thinking ahead and planning for what's around the corner, even if we can't see it. So that will be fully integrated into all of our future strategic thinking and planning. And then finally, and I think this is the one that's most important in many ways, is just because you've always done something doesn't mean you should keep doing it. And we had to say that over and over again. Just because we did it that way before doesn't mean it's still going to work. It doesn't mean it's what people need. And it just wasn't going to always work in a pandemic. And so we had to do it differently. And then a lot of times wound up saying, you know what? Wow, that is so much better than it was before. So really being embracing change and embracing thoughtful change, along with just recognizing not doing something because you've done it, but also being careful, not getting rid of something just because you've also done it as well. Just making really key, informed, thoughtful decisions along the way. So with that, I think I will turn it over. I think I get to turn it over to Katie.
Thanks, Susan. Hi, everyone. I'm Katie Ray Jones, CEO of the National Domestic Violence Hotline. We provide confidential services 24/7 to victims and survivors of domestic violence and their loved ones. And we do that through phone, chat, and text messaging services. We also run a program called Love is Respect, which provides essential healthy relationship education to young people ages 13 to 26. As Debbie mentioned at the start of the call, COVID-19 has affected us all. And right now, millions of domestic violence survivors are dealing with a different type of pandemic, and that's sheltering in place with their partners who choose to abuse them. Like the National Runaway Safeline, we're also commemorating an anniversary, not as long. We are commemorating our 25th anniversary right now. We've been around since 1996, and we receive funding through the Family and Youth Services Bureau through the Family Violence Prevention and Services Program, and we are incredibly grateful for their leadership and support over our tenure as an organization. We are the only national 24/7 hotline that is dedicated to serving victims and survivors of domestic violence. And our work really rests on three pillars: crisis intervention, prevention, and systemic change. The heart of the hotline is really our advocates who serve survivors through trauma-informed crisis intervention, personalized safety planning, domestic violence education, healthy relationship information. And then we refer to local programs or state resources. So we really view ourselves as a short-term resource to a long-term solution, hoping to make those connections to the programs in their local communities for that continued support and healing. Our main goal is to empower survivors to make life-changing decisions with dignity and respect. And our mission statement is about shifting power back to those who've been impacted by relationship abuse. We recognize that survivors need a wide range of assistance, and there's not a cookie cutter approach to services. So we've curated a robust database of roughly 5,000 providers and resources across the country, including the US territories, including shelter and transitional housing, counseling, legal services, culturally and linguistically specific programs as well. And you'll see here on this slide some of the data around the types of abuse. And in most cases, a survivor experiences multiple types of abuse. So whether they know or not, much like the National Runaway Safeline, this is self-reported. And so we're documenting as the individual is speaking about their experience in their relationship, what types of abuse they're describing. And we'll talk more about that when with what we've seen during COVID-19. But in the interest of time, you can visit our website, thehotline.org, to learn more about the types of abuse and how we categorize those. To date, we've answered over 5.5 million calls, chats, and texts from people in the United States and its territories. As you can see from this slide, we experience a high contact volume on an annual basis. Any given day, we're receiving anywhere from 12 to 1,400 individuals who are reaching out for services and help. In calendar year of 2020, we experienced a 2.3% increase in contacts received compared to 2019. 2.3% may not seem like a lot, except given the huge volume that we do receive, it is definitely felt on the lines by our advocates when we see any type of increase in demand for services. As you can see from this chart, since 2015, and anyone who's watching the news, you know that domestic violence is trending in the news more often than not, with a lot of high-profile domestic violence incidences being reported by the media. We've seen an increase of 46% in our contact volume. So during COVID, going into the pandemic last March, we really weren't sure what to expect. We've not had something of this nature to compare to, aside from natural disasters that we've seen in our country. So what we did realize is that noting that some survivors have been in close proximity to their abusers and their partners who might be using violence during this time, we're not sure what that increase may have looked like had we been outside of a pandemic, if people could have felt like they could have reached out safely for resources and assistance without being under watch from their partner who's using violence. This was the case definitely for us here at the hotline, as well as our partners at the Strong Hearts Native Helpline, who I'll talk more about in a minute. But in the very beginning of the pandemic, we did see a decrease in the contact volume that was coming into the organization, as well as on our websites, both for us and Strong Hearts. We also saw it on social media channels, recognizing that for folks who were able to reach out to us for support, they would often speak about their conversations being monitored, their partner looking at their phone to see what they were looking at, or their laptop, or any device that they might be seeking information from. So it was really a tricky space to think about safety, knowing that many people were in close proximity to their partner who was using violence. For Strong Hearts, their website was a resource of information as well, so that knowing that if someone could also access information via social media or on a website, that they might see increases in those spaces. We're beginning to anticipate, as we're hearing more and more states reopen. The hotline is headquartered in Austin, Texas, so we are a state that has been reopening quite aggressively. That more people, as more people are vaccinated, we might continue to see people reach out, and then we might truly see what survivors have been experiencing during this last year, a little over a year in some places. Before we move into talking about the hotlines data, just want to take a moment to speak about Strong Hearts Native Helpline. Back in 2012, the hotline began discussing with the National Indigenous Women's Resource Center the need for a domestic violence hotline to support tribal communities across the United States. While we were hearing from survivors who were identifying as Native, there was a lot of complexities and jurisdictional issues that made it really difficult for us as a national hotline to really be able to support survivors the way we had hoped to be able to do. So with input from tribal leaders, a Native Women's Council, domestic violence experts, and the support of the Family Violence Prevention Services Program in the FYSB office, we began laying the groundwork for a Native-centered hotline that would be staffed by advocates with a strong understanding of Native cultures and issues of tribal law as well. So in March 2017, the Strong Hearts Native Helpline was made possible by support from the Administration of Children and Families. We did receive some private support from Verizon and the National Football League prior to that to allow for our groups to convene and strategize to develop the strongest program that we could for Native survivors. And so Strong Hearts is a culturally appropriate and confidential service dedicated to serving Native American and Alaska Native survivors of domestic violence, dating, and sexual violence, as well as their loved ones. And you can visit strongheartshelpline.org for more information. On this next slide, what you see now is a part of the Hotline's internal data dashboard for contacts who indicated that COVID-19 was a condition of their experience. Obviously, COVID-19 was not something we were tracking prior to March 2020, recognizing it was quickly becoming a trend in contacts that were reaching out to the organization. We went ahead and added some data fields that we could begin to track the survivor experience. We know, as being a trusted resource for many survivors, we knew that we had to be prepared for how this pandemic impacted them and would ultimately put them at a greater risk. We know that a lot of external factors that add stress, isolation, and financial strain can create circumstances where a survivor's safety is further compromised. As I mentioned earlier, we did have some information related to natural disasters, and we've done a lot of research regarding the survivor experience during those instances. And what we knew was that survivors would report that while abuse wasn't new in the relationship, the intensity of the abuse and the frequency of the abuse had increased. So we thought that we would begin to see similarities between natural disasters and this pandemic, with the exception of survivors may not have the opportunity to reach out safely for help. We also know that oftentimes partners who are using violence will provide misinformation and create further fear in order to control, isolate, and continue the abuse in the relationship. So many survivors were connecting with us to learn exactly what they could and could not do safely during COVID-19. We were relying heavily on the CDC's guidance because it was varying state to state. So as a national hotline, that was a challenge for us. And our advocates were doing critical safety planning and resources. Like Susan had mentioned, much into domestic violence shelters across the country. We did see that shelters were working really hard to keep their existing resident population safe and healthy, and it was creating challenges at times for survivors who were seeking shelter to be able to access shelter safely. Additionally, we also had a lot of survivors who were fearful of going into shelter or seeking medical treatment in fear of getting exposed to COVID-19 as well. So these were new experiences for us that advocates were doing. A lot of the tools we would typically use in our safety planning toolbox weren't necessarily available during this time. And so we were doing a lot of unique individualized safety planning about how to stay safe in place, what tools they could use even for their emotional safety alongside their physical safety. And so since March 2020, nearly 25,000 people contacting the hotline cited COVID-19 as a factor of their experience, which equates to about 6% of our contacts. Strong Hearts Native Helpline also found during COVID-19 that their contact volume decreased at the start. And what they reported during 2020 is that 68% of their contacts needed peer support from their advocates, while 35% needed access to shelter, 27% needed legal advocacy, 11% transportation, and 19% emergency financial aid. And that mirrors some similarities to what we were hearing at the National Domestic Violence Hotline, and we continue to hear is this piece around emergency financial aid and direct cash assistance being critical pieces to recovery and healing for many survivors. We'll be sharing additional information as an attachment, discussing the Strong Hearts findings in the email that was referenced at the beginning of the call. But I did want to touch briefly on the types of abuse that Native survivors mentioned when contacting Strong Hearts. They're reporting 87% of Native survivors experienced emotional abuse, 78% physical abuse, and 31% financial abuse, 19% digital abuse and sexual abuse, and 10% cultural abuse. So this data really shows us how pervasive the issue is and emphasizes that relationship abuse can happen to anyone. We're incredibly grateful for the hard work of Strong Hearts and all the culturally specific services who can truly serve survivors in unique ways. I think we found during this time, the cultural aspects that were impacting survivors were quite profound. And the need to have those relationships, just as Susan mentioned, for their target population has been really, really critical for us to ensure that we were providing services that really resonated individually for survivors. One thing we wanted to show on the screen now, you'll see a word cloud that captures the frequently mentioned details and barriers from our lines. And while you're looking at that, just a couple stories that we heard on the lines. I mentioned as well about the difficulty of sometimes accessing a domestic violence shelter because they were really working to keep their existing population safe. So we did hear that survivors were asked to get tested for COVID-19 prior to entering the shelter. And then while they were waiting for the results to get back, the shelter lost the availability that was there prior. So that was a challenge and certainly frustrating just due to process. And many of us were moving with a great deal of uncertainty to be able to identify the safest ways to keep everyone we were trying to serve safe. We also had a lot of calls around the isolation piece and how the partner who was using violence was isolating them from family and friends. We had an individual who reached out who indicated that their abusive partner had recently lost their job and had received severance pay, but refused to contribute to any of the bills. And the survivor had actually lost their job shortly afterwards as well. We heard about stimulus checks being stolen by the partner who was using violence and survivors not having access to those funds, as well as really a lot of fear where we would hear stories about the partner who's using violence coming home and coughing on the survivor or the children, and then telling them that they were going to have COVID and they wouldn't pay for any of their medical treatment. So there was a lot of fear in the homes. And then the amount of family, friends, even coworkers who were reaching out concerned for someone, asking for safety tips on how to best engage with the person they were concerned about, knowing that their partner who was abusive was in close proximity. So this was really out of box thinking for us as an organization, I know for many domestic violence advocates across the country, to try to think of how do we keep everybody safe as possible in some instances. So this is just a snapshot of what we're seeing. Certainly, as I've mentioned, we've heard from survivors how their abusive partners monitor every single move, forbid them from leaving the home. We heard stories that even in communities where they were reopening, one survivor reported that their partner had pulled a firearm out to keep her in the home and not let her leave. So that was something that had not happened before to her in her relationship, certainly terrifying and a lot of fear in that home. I mentioned the stimulus checks being stolen or money being withheld. We know financial abuse shows up in over 95% of relationships where there's abuse occurring. So we anticipate, as we know, a lot of survivors try to plan their exit through financial stability. We heard survivors who were on plans to leave and were saving money, oftentimes secretly, and not able to contribute to that plan because of a loss of wages or because their partner had taken the funds that they had saved and discovered where they were keeping them. So responding to the crisis of domestic violence, I mean, we did a lot of media during this time around it really being a community effort and the importance of friends and family reaching out. We activated a bystander key messaging campaign to ensure that people might have these small windows of opportunity to connect with a survivor, to check on their safety or provide them hope. We did hear a lot of hopelessness and fear from survivors who were reaching out. And we know that family members and friends are a great resource to be able to keep survivors feeling like there would at some point be a light at the end of this tunnel. We did publish a lot of resources and blogs on how best to support survivors during the pandemic. We saw a huge amount of traction from that social media and blogs being reshared, reposted, leveraged through media, recognizing that was certainly a space that community members were wondering what they could do, hearing from neighbors who would speak about hearing violence occurring next door to them, not sure what they should do in those instances as well. So now we know that even once the pandemic is over, that there will be the long-term effects on health, safety, and financial security, and that this must remain a top priority for domestic violence advocates across the country, and how we as community can all work together to respond to the growing and changing needs of survivors during this incredibly difficult time. And so COVID-19, obviously, as we've said, not necessarily unique to the National Domestic Violence Hotline, has affected us all in ways we never could have imagined. As Susan spoke about, we transitioned our entire advocate staff to remote status in a matter, I think it was 72 hours, which was incredible. Similar challenges to the National Runaway Safeline, ensuring that we had the right technology and support for all of our staff in their homes. It was an incredible lift. We had, again, tremendous support from the Family Violence Prevention Services Program. We had the Allstate Foundation provide some additional money to support the purchase of additional technology to get us to that remote status. But like the National Runaway Safeline, we did not lose operations for a minute, which was great, because if we do, we roll to the National Runaway Safeline. So thankfully we didn't have to do that. But as we did recognize, the National Domestic Violence Hotline does serve as a backup to other national domestic violence hotlines in local communities. So during this time, we had other local programs who were rolling their hotlines over to our organization to support their existing clients while supporting their staff who may have been impacted by COVID. And then just recognizing that, in the beginning, you all will remember, there was just a lack of information about the pandemic. How long would we be at home? And so this was really just a challenge for all of us. And the amount of misinformation that survivors had about the pandemic was really just phenomenal, of how abusive partners were really leveraging the information to create fear, intimidate, and isolate even more so survivors in their home. So as we've been in the balance between respecting restrictions in their states and keeping survivors and shelters safe while continuing to serve people, it was a difficult one, and it made it extremely challenging to provide services in the same way. But we are so grateful to the local providers and the resources in local communities who really engaged in new ways. We had local programs who were able to get relationships with hotels and use hotel rooms for emergency stays for survivors. We had churches who would provide financial assistance for a survivor to get to a safe place at night. And this is really a sense of community coming together to really support the needs of survivors. So as Susan talked about, what comes next for the hotline and what lessons have we learned? So one thing that we will be doing next is that we will be text enabling the hotline's toll-free number. As I mentioned, we do offer texting services through our program Love is Respect, but you'll be able to dial 1-800 or text 1-800-799-SAFE and be able to also connect with the National Domestic Violence Hotline with a trained advocate. We want to make sure that people have the safest ways to reach out when possible. We're also working on expanding our staffing at the advocate level while still ensuring that they receive high quality trauma-informed training to serve survivors better. I think, as most of us are all recognizing, staff members do enjoy, for the most part, at home working, but it is important to recognize those pieces that Susan mentioned around caring for staff, recognizing the amount of trauma that they're holding in their home, maybe by themselves. The importance of staff well-being, it really surfaced for us as a top priority, and we'll continue to invest in that space. We're also working to share our provider database on our website so that anyone can find that local program very easily without having to connect with an advocate. And this next year, we'll actually be piloting a shelter bed availability program where we'll be able to test out a system in which we can see where there are beds quickly, and hopefully reduce that time lapse of when an advocate or a survivor needs to call multiple shelters before finding a place that is safe for them to go to. We also established an official partnership with a branch of the CDC that provides access to some of our data, and they're going to use our data in their work and blend it with other data to get a better understanding of the issues pertaining to the impact of economic pressures and shelter-in-place orders on call patterns. So this will be really an incredible opportunity. They're going to issue different briefs that you'll be able to find at our website when those are available. And then really excited that we have built a new relationship with the support of the Family Violence Prevention Services Program on a partnership with HRSA, which is health resource centers across the country. And we will be doing cross-training with the community clinic staff, as well as our advocates, on how to cross-refer when needed. And our database will now encompass the community clinics across the country as well. So as we know, with the long-term health impacts of the pandemic, this will be a critical resource for survivors in order to access healthcare safely. So hopefully this was informative and helpful. And with that, I'll pass it over to Megan.
Awesome. Thank you so much. So my name is Megan Cutter, and I am the director of the National Human Trafficking Hotline, which Polaris operates on behalf of the U.S. Department of Health and Human Services. And Polaris is a nonprofit based in Washington, D.C., and we are part of a data-driven social justice movement to fight against sex and labor trafficking. And the hotline is a really core piece of that work. Polaris has been in existence since 2002, and we've been operating the hotline since 2007. Big thanks to Susan and Katie and to FYSB for having me today. And, it's really great to hear from other hotlines about what they've experienced and also what they've heard from victims and survivors and the people they serve. I think that's actually been one of the benefits of not benefits of the pandemic, upsides of the pandemic, where we've been able to kind of collaborate and hear from each other. And so I'm just grateful to have this opportunity today. So the National Human Trafficking Hotline is a 24/7 resource that's confidential and toll-free for victims and survivors of human trafficking. So anyone who's been forced to have sex for money through means of forced fraud and coercion, or anyone who's been unable to leave a work situation without severe consequences to themselves or to their loved ones. And we are available in English and Spanish and directly when you call us. And then if there's another language need, we can access that through a teleinterpreter. So there are 5 ways to contact the National Human Trafficking Hotline, and the most common way to contact us by far is by calling, but our fastest growing method for reaching out is actually text messages, which you can imagine is for a couple of reasons. I think a big one being safety and privacy. We've also really found that survivors reaching out via text can control the pace that they're using to answer questions. They can stop, take a break. Maybe if the situation is safe sometimes, but not others, depending on their trafficker or abuser, what's going on there. There's just a little more control than having to be on the phone. And then for folks who maybe aren't available or interested or have the space to have a conversation back and forth, they can reach out via an online reporting form or via email. And that also offers its advantages as well. And so the 3 24/7 ways to communicate are the call, text, and web chat function. So in terms of what does the hotline do and what do we help with and how we can support, I wanted to share this graphic because I think it visualizes the different, the process that folks go through when they reach out to us. And so once we answer the phone or respond to the text message or the web chat, we're first going to just make sure that someone is in a safe place to talk to us. And then we'll share a little bit about our confidentiality policy and mandated reporting and making sure that we give folks informed consent. And we'll also share what we help with. I think human trafficking, and this is something that I know other hotlines face as well, but human trafficking in particular is a phrase that doesn't really tell you what the crime actually is. And so we do a lot of, sharing the definition, explaining what this looks like in practice so that folks reaching out can decide for themselves, like, oh, that does sound like something I'm going through, or that does sound like my situation. And so that often actually happens in that first piece of the call, because one of the first things folks say to us is, I'm not even sure if this is the right place. So once we confirm that, it makes sense for us to keep working with this person, or if we should redirect them to another resource, we then do a more in-depth safety assessment, really thinking about what is the long-term, how long can we be on the phone with this person? Is it safe to call them back if we get disconnected? All of that. And then we'll move into needs. And there are 3 buckets of needs, and people can pick from all 3 or just one. And what we really are looking for in this part of the conversation is, what is it that the person reaching out hopes to accomplish, hopes to do today when we're having this conversation. One bucket, which I would say is one of our most common, is connection with service provision and with referrals. So people who are looking for shelter services, who are seeking legal assistance, counseling, support like that. And the National Human Trafficking Hotline has a database of just under 1,500 human trafficking specific service providers across the United States and its territories that can support survivors who are calling in. And so our goal is to connect them, much like the other folks you heard from today, to connect locally with whatever resource best serves them and best supports that population. And then the second bucket is reporting to law enforcement. So we have a database of law enforcement contacts who are trained in human trafficking, trained in a trauma-informed, survivor-centered approach, and who have experience working on this crime. And what we can do, if, particularly for adults, if they are interested and they feel comfortable and safe, facilitate a report to law enforcement on their behalf, and really highlighting the pieces of their situation that are connected to human trafficking, and helping kind of form a narrative that that allows law enforcement to take some next steps and to follow up. And then the third bucket is a little more nebulous, but no less important, and that's around safety planning and working with people who are still sort of contemplating what it is that they want to see happen next. And there we'll lay out all the different options and ways we can support. And much like I believe Katie said earlier, our approach is very similar in terms of working to offer choice and empowerment to folks who can make choices and decide what they want to see happen next. Human trafficking is a crime that often takes away autonomy and choice and decision. And sometimes we're the first step for someone to get to decide, you know what, I'd like to leave, and this is the way I'd like to leave, and this is the safest way to do that. And so that third bucket is often maybe takes the longest, where someone is trying to decide what they want to see happen next. But it's no less important. In fact, I'd say it's often significantly important. And so once we get through what the person needs and they're looking for, then we'll move into learning a little bit more about the situation. And from there, it really depends what they need, what kinds of questions we're going to ask. So if they're looking to report to law enforcement, the call is going to be a lot longer, a lot more detailed, because we need a lot more information about specifics, about phone numbers, addresses to pass along. Whereas if we're looking to connect someone with a local resource like a shelter, we might be asking demographic information or about, what barriers they've faced to receiving shelter in the past. And this is something we've really heard from survivors, that it's important. They don't want to, and I think we can all understand this, and maybe have been through this ourselves, to answer a bunch of questions and then have to call another place and answer the same question. So we really focus on only asking what's needed to get someone to the appropriate resource and make sure their need is met. And then this response piece really looks different on every single call. Depending where someone's located, if they're in a rural area, it might be a little more difficult to find resources, or if there's a particular need around cultural competence, we want to make sure that we meet that. And so sometimes that can take, a few more phone calls or a little bit more advocacy. And so we are always happy to do that, and we'll put that in place. And that could also look like this response piece, the reporting out to law enforcement. So that's sort of the big overview of what we were doing pre-COVID and what we are still doing, but in a different way for sure. We can go to the next slide. So this crisis in human trafficking during the pandemic snapshot that focuses on last April, which I cannot believe was a year ago, will be available on the website that is going to get linked at the end. And so it's also available on the Polaris website if you are interested in a little bit more detail. But what we've done is looked at that initial kind of first full month of things being shut down and compared it to April 2019, so the previous year, and then to the period just before stay-at-home orders were in place in many parts of the country. And what we found, although we saw some changes in the number of incoming contacts to the National Human Trafficking Hotline, what was most significant, and certainly in my opinion most important, is that we saw a 40% increase of crisis cases compared to the control periods, and then requests for emergency shelter nearly doubled. So much like the other folks have shared today, there's this real difference in the urgency of need in the type of request. And that really shifted our ability as a hotline to respond and to support folks, particularly because of the impact that the pandemic was having on availability of services. And we definitely had to get creative and think about safety planning in a way that we hadn't previously. A go-to prior to the pandemic, when someone was looking for a safe place to stay that was open 24/7, was, maybe go to the emergency room and sit in that lobby for a little bit and go someplace warm, or go to a library or a McDonald's. And suddenly those places weren't safe options or safe choices, and they weren't even available. Or in the case of the hospital, maybe it was the most unsafe place to be. So that definitely shifted. And at the same time, we saw an increase in urgency and an increase in need. We can go to the next slide, please. And this also connects to one of the things that, particularly with any form of abuse, but we really see this with human trafficking, is that traffickers are exploiting vulnerabilities. Trafficking, just like domestic violence, is a crime of power and a crime of control. And so when there's something that someone can use to have power over another person, there's this opportunity for trafficking to happen. And COVID-19, as many of us know and maybe have personally experienced, has exacerbated existing vulnerabilities. People who were already struggling or needed support may have had additional needs. And then people who really weren't vulnerable pre-COVID may have had some changes in their life where they now are vulnerable, particularly around, economic empowerment and job options and job choices. That's something that we've really seen change for many, many folks. And traffickers often exploit that and say, oh, I've got a great way for you to make some money. I've got a really good job offer. And the reality of that situation then will change and could be a sex trafficking or a labor trafficking situation where the person then is unable to leave without really severe consequences. And then I sort of touched on this before, but settings that might serve as access points for help, not just as places for us to safety plan and encourage someone to go to, but also places where someone might identify that someone seems to be a survivor or seems to need help or might benefit from, for example, having the National Human Trafficking Hotline phone number or calling together. Those settings weren't as accessible for people. Maybe, I know, at least for me, I definitely postponed doctor's appointments and things like that. And schools where people, kids were going in person every day or not every day. Maybe they didn't have great attendance. Maybe there wasn't great access to those resources, but there was some access and there was some system where someone had to show up and be there. And that shifted during the pandemic, as we all know. And so those things, I think, are things that we've all been thinking about this year, but particularly on the trafficking hotline have been thinking about how that connects to who's reaching out to us, how they're reaching out to us, and why, and also the types of requests that are coming through. And I forgot to mention this on the previous slide, but that piece about who's reaching out to us and why, I think also really impacts the data that I shared with you, because we know that not everyone knows about the hotline. We know that not everyone feels safe calling or is able to call. And so what we see, this is just a lens into what there is, the bigger picture of what might be happening, and really only shows, the people who have the ability and resources to reach out to something like the National Human Trafficking Hotline. And that's an important piece as well, especially when we think about vulnerabilities and we think about access. We can go to the next slide, please. And then another thing that we did over this past year that I think was really interesting and echoes what has already been shared today is to survey our service provider partners on the ground and get a sense of what the impact was on them. And the purpose of this was both to understand, but also to make sure that our internal system that advocates use to locate resources when survivors call was as up to date as possible, because we wanted to make sure that we weren't wasting time and resources both for the survivor and for the service provider partner in calling places that weren't accepting new clients or had to close or whatever the case may be. And so we found a broad range of things, and much of this is still continuing to shift as state guidelines change and as vaccines are rolled out. But I think the first thing I would highlight is just huge amounts of resilience and flexibility on the part of service providers on the ground. And I know we've got some of you on the call today, and just want to say thank you for continuing to do this type of work in such a challenging environment. I have so much admiration and respect for the work that happens on the ground. And we couldn't operate a hotline without it, because our whole purpose is to connect into that network and those resources. So most folks really did try to continue operations as much as possible. There was a lot of a shift to telehealth services and thinking through, what would be a confidential, appropriate platform from which to do that, how to implement public health guidance. And then in terms of emergency shelters, we saw things that really ran the gamut, from people who were open, accepting new referrals, places where there were limitations, and then places where shelters said, we can't even continue to operate, or we just can't accept new clients at all. And then some new screening protocols in place and limitations for symptomatic clients. And I'll talk about this in a lessons learned slide, but one of the things that we really found to be a useful sort of stopgap, especially in terms of when there were testing needs before entering shelter or things of that nature, were hotel stays and places where survivors could be in isolation while they waited for those test results, or while they quarantined if they were sick. And I think that's a big area of opportunity that hotel vouchers and hotel stays have always been a need in this space, but really was significant over this past year. And then we also heard just some challenges operationally for service providers that I think are important to recognize as well. And this limitation to in-person outreach, limited hours, maybe taking longer to move through specific processes because they had to comply with social distancing and they had to find ways to keep everybody safe. And then financial implications of the pandemic that led to smaller staff, maybe higher caseload for people who remained on staff, and what did the implications of that look like. And that was something I think we weren't really expecting to hear about through this survey. We were, wanting to make sure we had the most up-to-date information, but I think that context is really important as we think about kind of the ways in which national hotlines interact with those that we refer to, is to really be aware of some of those limitations and challenges that folks on the ground are facing. So that's something I wanted to make sure to highlight as well. We can go to the next slide. Don't want to dig in too much to the first two bullets, because I think that's already really been touched on, and exactly what Susan and Katie shared. We also shifted within 72 hours to an entirely remote staff, previously having not been remote at all. We had no downtime, and we were really, really proud of that, but it was a process. And wellness, taking these types of calls and text messages from your bedroom, from your kitchen, finding a way to maintain confidentiality if you live in a shared household, or taking on that vicarious trauma if you live by yourself. All of those things, we can really relate to. I think the thing that maybe is most unique on this slide is that, as some of you might remember, particularly in mid to late summer of 2020, there was some very significant viral misinformation about human trafficking that started with allegations against Wayfair, a furniture company, saying that they were sex trafficking children, and then kind of spiraled into a lot of similar allegations against other companies. Law enforcement looked into that very, very quickly and said that those things were unfounded. But a lot of people who were very well-intentioned and very concerned reached out to the National Human Trafficking Hotline in that period to make reports. And what they were reporting was information that was already publicly available. They didn't have any additional details or weren't connected to anyone being victimized in those situations, but they were reporting what they had seen on the news. And that really flooded our phone lines in a way that was very difficult and made it very difficult for survivors to get through. And then also finding a way to productively take some time to educate and redirect folks in a way that didn't feel disempowering, but then also to get them off the phone and keep the lines open. That was a unique thing that we faced last year. And we took it as an opportunity to really educate staff on how to do that compassionately, and to develop some resources about myths and misconceptions about human trafficking that we can redirect people to, so that they can make sure to be informed and identify human trafficking when it's happening in proximity to them in a way that's really productive and useful. So that was a unique one that we certainly wouldn't have expected, but we have some good learnings that have come out of that. And I think been able to have some good dialogue in the media about what really creates situations where trafficking happens. And as I said before, it's vulnerability and exploitation of vulnerability and that presence of power and control. So it ended up being an opportunity to emphasize that, but it was certainly an obstacle. And we can go on to the next slide. And just being conscious of time, I'll be pretty quick here, but I think that the resiliency of every single person that we work with, whether it's internal staff pivoting, whether it's survivors, sharing their own safety planning tools that they've thought of that are really creative and, in line with the pandemic. We always say survivors know their situations best, and that's absolutely been true this year. And also of the service provider partners and law enforcement partners, as I mentioned earlier. And then just creativity and adaptability and being able to change and recognizing, like Susan said, just because we've always done it this way doesn't mean that's the right way. A lot of my team who work Thanksgiving every year said, maybe we could always work remotely on Thanksgiving and then I could be with my family. And I thought, that's a good idea. Maybe we could do that. So there are pieces there that I think maybe we had just never considered that we'll be able to take into 2021 and beyond. And then just an anecdote around the hotel and flight vouchers. This is something Polaris is really grateful to have partnerships with airlines and hotel companies. And we've always been really clear that those resources need to be used in conjunction with the service provider and for a limited period of time as a stopgap. And our definition of a limited period of time changed very quickly as the pandemic went on, because at first we were like, well, our policy is really for the weekend or 2 days until someone can be admitted to a shelter. But we started to hear from providers that there were weeks or, longer periods of time where someone needed those resources because of quarantining and testing requirements. And, I'm really proud of the team for looking at our policies and saying, okay, these need to shift and these need to change based on the circumstances and based on what we're hearing from survivors and from our partners in the field. And I think that's the key of continuing to listen and continuing to be open and to pivot as needed. So I think that's all I've got today, but it's been really nice to share, and I'm excited to have some space for questions, and really grateful for all of you for listening and taking the time to be here.
Awesome. Yes, thank you. Thank you, Megan. So we're going to move into the Q&A portion of the panel. We have a few questions that I think that we'll go ahead and share out now. So the first question that we received was for Katie and the Domestic Violence Hotline. Are there any links for the bystander campaign or anything else you would like to share about it?
Yeah, thanks, Catherine. I went ahead and dropped a couple links into the chat for folks around the blog that we wrote to support survivors, as well as some additional information around staying safe and safety planning. Hope that's helpful.
Awesome. And we can make sure that that's included with some of the materials that we share out afterwards. All right, the next question I have is from somebody who also is in charge of a crisis hotline within a larger organization, but due to COVID-19 and lack of staffing, they are looking at ways to outsource it for a bit while they figure out their staffing situation. Do you guys have any advice on how they can handle the situation, or any pointers or other organizations who might take over their crisis hotline for them? This is for all three.
Thanks. Well, I can chime in for if it is a domestic violence organization, you can actually roll temporarily to the National Domestic Violence Hotline. We do offer that service for local programs across the country based on their situation. And then so you can reach out to me, and I'll put my email in the chat that you can connect with me for more information if it's that topic.
I would just echo a little bit what Katie said. It would really depend on what the kind of the nature and the content of the focus of the hotline would be. And so certainly for us, we're focused on providing support and services for youth and their families. So if that's the age range and the focus, then we're certainly happy to talk further. Similar to the National Domestic Violence Hotline, we also help to provide support and services to a hotline through the state of Illinois. But again, it really will vary depending on the content and focus. We don't want to be, and I would think that the other hotlines are similar in this, to take on support and services for a topic or content that we don't necessarily have readily available resources, services, or staff isn't maybe particularly trained on certain topics or services that folks may need. That would be the challenge.
Awesome. Okay, so next question. Are there any recommendations or resources available for training new staff on answering crisis contacts through a crisis hotline? This is for all three.
So I think, again, if somebody would want to reach out individually, and we would be happy to, through the training resources in our training team, to see, what somebody might be looking for, what the needs might be. It's actually also something that some of us are involved with through the National Hotline Consortium, where we're actually taking a look, which is just a consortium of a number of national hotlines, including, of course, the Human Trafficking Hotline and the National Domestic Violence Hotline, but goes beyond that. And we actually have been talking about this very topic in terms of how to make this kind of training and other sort of shared or more common resources available. But I think that we're certainly happy to talk about that further.
Awesome. We received a question just asking, what areas do you serve? If I'm correct, all three hotlines serve all 50 states and US territories, correct?
That's correct.
So we will move on. This is for Susan with the National Runaway Safeline. Can you please expand on the mental health issues and experienced by youth reaching out to the Safeline?
Sure. So I think keeping in mind that when young people reach out, it's very self-driven. The whole idea about how we provide support and services is ensuring that it's non-judgmental, it's confidential, and it's non-directive. So we're, again, having and working with young people to kind of lead the way, but helping them to have the access to the information to help make informed decisions. In terms of the reference to mental health, it could be anywhere from anxiety to depression to the suicidal ideation or imminent risk of suicide that we've talked about. So it sort of has run the gamut. So I think it's been very consistent with a lot of what we're seeing kind of spoken about, talked about, articles published about nationally in terms of the overall impact on young people in this country that the pandemic has had. And so it's been very consistent where young people are just reaching out and sort of self-identifying or noting that they are experiencing an increase in these sort of feelings or the level of anxiety or some of the things that they are facing, or maybe reaching out to us and asking for local resources or ways to get available support around kind of mental health support and resources that might be available to them. So I'm not sure if that answers the question or if there was more that was kind of looked for. Sorry, got a little distracted by the other question that got posted.
I think that covers it. All right, for Katie and Megan, this is for you both. What barriers have you faced in getting vouchers for hotels and flights? And what are some of the ways that you've overcome them?
Do you
Megan,
want to
do
go
you wanna
first?
go first?
Okay.
You go.
Okay, cool. Yeah, this is such a really good question. I think that one of the things that we've really been able to leverage through the national hotline is our national level relationships. And then what we do for both flights and hotels is when a survivor reaches out and we're connecting them with a service provider, or when a service provider reaches out and there's a need that one of those things might fill, is we work with them to basically release the resource to them. And so that's been really useful, because I've heard specifically from service providers on the ground that they may have a partnership with one hotel in their community, but if all of the rooms are full, or if they have a set number of vouchers, I think those are some big barriers. And then I think for flights, it's often a barrier of, does someone have an ID? Are they comfortable traveling on an airplane? Is there a clear plan to get them to the airport, pick them up from the airport? So there's a lot of different considerations, but I think one of the things that we've found as a national resource is to serve as sort of a like coordinating function, and then to release the resource to the person on the ground who's making sure that all of those puzzle pieces are in place. That's been helpful in eliminating some of the barriers we've heard about from local providers. And I think that that has been something that was really beneficial during the pandemic. And so if that's something that you have questions about or are interested in, you can definitely reach out to me directly. If you are working with a client who might need those resources, and as a survivor of human trafficking, or you yourself are, definitely reach out to the National Human Trafficking Hotline. Trying to think I'll let Katie weigh in on anything that she's seen on her end, but that's sort of generally what we see about the process from my perspective.
Yeah, and our process at the National Domestic Violence Hotline is a bit different because we do not collect identifying information on our contacts. So we are going to connect to the local program to explore options for them regarding hotels or flights. And then if the local program is in the process of looking, we will then go to our database and look at churches, other local community resources that might have the ability to support someone, and we'll make those calls on behalf of the survivor. And then if we find a match, then we will link them directly to that referral once we can do that.
Great. So we have time for, I think, one more short question, which is a follow-up to the voucher question. Is there a set mechanism for smaller organizations to reach out to you for vouchers?
Yeah, that's such a good question. I'll put in the chat the email address. This is for service providers specifically, and we're really only able to offer these resources for human trafficking survivors. But that's the email you can use to reach our team that manages these resources. It's transportationrequests@polarisproject.org. I'll write it because the S is seems silent, so I'll make sure that gets in there. But you can reach out and even just say, I'd like some information about how this works, and the team can share some details. And if there's a specific scenario, can get the ball rolling. That's not an urgent response mechanism. So if you need something in a time-sensitive manner, definitely reach out to the National Human Trafficking Hotline directly.
I just wanted to jump in too, just to emphasize, depending on the age of the person that is in need of transportation, just to, as a reminder of the Home Free program through the National Runaway Safeline, which provides bus tickets and free transportation services and resources through the hotline, is also an avenue for transportation. We have worked with young survivors of human trafficking and domestic violence and a range of myriad of different issues and circumstances. And so that is another option for transportation to safe shelter, housing, etc.
All right. Well, that is all the time we have. So I believe we'll be closing this panel. Thank you to all of our guests for their insight into the past year, the challenges faced. Susan or Anna, I'm not sure if you have any closing statements, but thank you all for attending.
Thank you. Take good care.
Thank you everyone for joining us today. On behalf of the Family and Youth Services Bureau, we thank everyone for taking the time, and I hope this information was helpful. We're going to be sending the email with all the resources that you will need and posting the recorded session in few days. So thank you so much. Stay safe and take care. Bye-bye.
Bye-bye.